Hi, my name is Ryan Hershberger, student in Kinesiology 539. Today I'm going to be demonstrating the barbell back squat and going through a little bit of what's going on with that exercise. So first off, the main agonist muscles are going to be your glutes and your quadriceps, and then antagonist muscles are going to be your hamstrings predominantly. So first off, with positioning and getting set with the bar, we're going to use a pronated grip, closed pronated grip. Hands are going to be about shoulder width apart. The bar, for the high bar position that I'm going to be demonstrating, is going to be sitting above the deltoids at the base of my neck. And there's also a low bar position where the bar would be below the deltoids. Most important in the setup is going to be that you maintain a neutral spine. So meaning that you're not rounding at all, you're maintaining a neutral spine, the chest is up, the head is forward. I don't like saying head up because then we get into a position where we have the chin bending too far up and you actually get the spine bending in the wrong direction with the neck. So just head forward, chest up, neutral spine position. Your feet are going to be about shoulder width apart. So I'm just going to demonstrate the setup position, unracking and walking back, and then we'll go over the lowering phase as well as the upwards phase of the lift. So that would be starting position for back squat for a high bar back squat. You know, obviously I just unracked, I walked it back. Next would be a lowering phase or an eccentric phase. So I'm going to allow my hips and knees to flex, and they're going to flex at the same position, maintaining the same torso angle relative to the ground the entire way down and the entire way up. So I'm going to allow my knees and hips to flex as I go down, and I'm going to lower down until my thighs are approximately parallel with the ground. Then I'm going to raise back up, extending my knees, extending my hips through that position. As I'm lowering, I'm going to use breathing technique called the Valsalva maneuver. I'm going to breathe in, and when I'm at the bottom, I'm going to brace my spine I'm going to brace my torso, and I'm going to enable myself to have a strong neutral spine in the bottom position by breathing in deep, inhaling, and then exhaling on my way up. So that's going to enable me to maintain a rigid torso. It can also help to use a weight belt with that, just to increase that intra-abdominal pressure as you're going through the movement. On the way back up, you extend your hips and knees at the same rate, just like you extended you flexed your hips and knees at the same rate going down. You're going to extend your hips and knees at the same rate coming back up. You're going to again maintain that neutral spine, and you're going to step the bar back into the rack and re-rack. So spotting, this is where I'm going to have Tyler demonstrate on this next rep. I'm going to go through the movement in an appropriate way, and Tyler is going to spot me from behind, going down with me, not touching the bar, not touching anything, just lowering down with me, and then I'm going to extend back up as we go through the movement. Yep. So like Tyler just demonstrated, he was spotting me from the rear, keeping the hands close to my body and going down with me, but not helping me at any point of that. There's also a technique to spot on either side of the bar, using two spotters where they would lower down with the bar from the sides. Some common errors. First, I'm going to demonstrate knee valgus. That's where the knee is going to cave inward, and the correction that I would use in order to address knee valgus would be to tell somebody to split the ground, split the earth with their feet so that they're pushing out and having appropriate knee tracking. So I'll demonstrate knee valgus really quickly. I'm going to cue split the ground. Split the ground in order to address that common error. Another common error would be that the knees and hips aren't extending at the same rate, and that not everything isn't coming up. You're not maintaining that same torso angle relative to the ground the entire time through the movement. That would look like something like lowering your chest first, coming down. You want everything to lower together, and come back up together, and then also maybe you lower everything at the same rate, but then you extend your knees and hips, and then you try to do what some people have called a squat back extension. So like you're literally doing a back extension as you're doing a squat, which is not what we want. We want to maintain that same torso angle relative to the ground. And to cue that, I would say keep your chest up, keep your head forward, keep your eyes forward, keep your eyes level, and just tell them, you know, we want to maintain everything rising at the same rate. So I'll demonstrate that really quickly, what it might look like. And I'll say, keep your chest up, or keep your torso, eyes forward, keep your torso up. Come down, okay, instead of rising hips first, we're going to rise everything together. So that's the technique and overview of the barbell back squat, along with some common errors and some issues that you might run into and how to address them. Again, Ryan Hershberger, kinesiology 539.